Hi everyone, welcome to OET Speaking class. Today we can discuss an OET Roleplay. Here the setting is a hospital ward. The nurse is talking with the patient who is now going to face cardiac catheterization. He is alcoholic and drinks a lot. Task begins with warm greetings. Reassure the patient and explain the procedure. Inquire about past medical history and family background. Inform him about the bad effects of drinking. Here, the setting is a hospital ward and patient is scheduled for cardiac catheterization. Here we can ask the name of patient during our preparation time. We can ask, how may I address you during our conversation? Assume the name is Mr. John. So you can start our conversation by saying, good morning Mr. John. Then he or she may greet you. Then you can continue by saying, my name is Sarah. I am one of the registered nurses working in this ward. Today I will be your attending nurse. Mr. John, how are you doing now? At that time he may express his concerns. He may say like this, Sister, I am scheduled for a heart procedure as I was experienced chest pain. Actually I don't know much about what's going on. So I couldn't sleep yesterday night. Could you please help me? At that time, we need to reassure the patient. You can say like this, Mr. John, I'm so sorry to hear that you couldn't sleep yesterday night. And I do really understand you are worried about the procedure. Try not to be worried. We all are here to help you and your health is our priority. Don't worry, Mr. John. I will explain everything in detail. Then you can explain about the procedure. You can say like this, Mr. John, today you are scheduled to undergo procedure which is called cardiac catheterization. It's a diagnostic procedure that provides important information about the structure and function of your heart. Is that clear? Then he may ask you questions like, Sister, this is first time I got chest discomfort and I don't have any other medical issues. And I'm really scared because there are many people dying because of heart attack. So I'm really scared, sister. At that time, we need to make him relax. You can say like this, Mr. John, I know it's difficult to cope with this situation. If I were you, I would react the same. Try not to be worried. Please be relaxed. There is nothing to get alarmed about. And Mr. John, in this procedure, a long narrow tube which is called catheter, it is inserted into the blood vessel of your arm to see whether your blood vessels in the heart are blocked or not. And it's just a diagnostic procedure only and it's not an operation. There is no need to scare about this procedure. And it's really important to do this procedure because we need to find out the exact cause of your chest pain. Are you following me? Again, he may ask you questions like, Sister, this means I might have heart attack or not. Is it something related to that? At that time we can reply like, Mr. John, I understand why you have this concern. The doctor advised you to undergo cardiac catheterization in order to find out a potential cause of chest pain. And Mr. John, early detection gives you the best chance for getting the right treatment quickly and avoiding further complications. Is that clear? Then as per our third task, we need to collect some history from him. So we can ask questions like, before proceeding further, can I ask you something to get a better understanding of your condition? Or you can ask, Mr. John, no, I would like to collect some information. Is that okay? Then you can ask questions like, do you have any relevant past medical history like diabetes, hypertension and high cholesterol level? Is there anybody else in your family is having this problem? These two questions you can ask one by one. Probably he may say you like there won't be any history of such problems. After that you can ask, Mr. John, do you have any habit of smoking or drinking? Because our last task says inform about the bad habits of inform about the bad effects of drinking. So we need to ask questions like, do you have any habits of drinking or smoking? Then probably he might be saying you like, sister, I consume alcohol because of my busy work schedule or whatever it is. At that time we need to give some instructions about the adverse effects of drinking. You can ask questions like, how often do you drink? How many glasses per day? These questions you can ask. Then you can say, Mr. John, I would like to inform you the adverse effects of drinking. If you keep on drinking large amount, it could lead to various kind of heart problems and other complications. So it's really important to quit drinking. Probably he might say you like, sister, I'm doing busy work schedule and I have a lot of stress at my work, so I consume alcohol. At that time you can say, I know, Mr. John, it's very difficult to change all of a sudden, but gradually you can make changes. We will help you for that. And you told me that you have lots of stress at your work. In order to relieve this stress, you can divert your mind to some other activities like yoga, and you can spend your time with your family and friends so that your stress will be relieved. Is that clear? Then he may reply like, sister, okay, I will try for that. We can say, if you follow our instructions, you can lead a healthy life, so that please follow a healthy lifestyle. Then we need to wind up our conversation. We can ask, do you have any other concerns? Sometimes he may ask you questions like, sister, is there any pain during the procedure? At that time we can reply like, don't worry, Mr. John, you won't feel any pain because you may receive an injection to numb the area before the catheter is inserted. Are you following me? Don't worry, Mr. John, we will be with you at every step to make you relax. Probably he may ask you questions like, sister, is there anything other than this? Do I need to follow before and after the procedure? Then we can say like this, please don't eat or drink anything for at least 6 hours before your diet, before your test. Please don't eat or drink anything at least 6 hours before your test. After the procedure, you will be able to eat and drink. Sometimes he may ask you questions like the length of hospitalization. We can say the length of hospitalization depends on your condition, because during the procedure, if the doctor finds anything unusual, we need to treat that. In that case, we need to do some additional procedures. Then you need to stay in the hospital. Otherwise, you can go after 12 hours. And you don't worry about that. We will take care of you at every step. Is that clear? Then you can wind up your conversation by saying, do you have any other concerns? If he has no other concern, we can say like, I hope I have cleared all your concerns. If you need any more help, just press the buzzer. Once again, I assure you that it's a minor diagnostic procedure to find out the exact reason of your chest pain, so that we can treat according to that. Also, it's really important to quit drinking. If you need any more help for that, definitely we can assist you. Okay, Mr. John, I'll be back soon. Thank you, Mr. John.